to start today, though, with putting a little perspective of history on the issue of HIV/AIDS. A few weeks ago, I spoke about this at an assembly at a middle school here in Providence. And there were a bunch of students in the room, and I told the story of a fundraiser that I organized back when I first started working in AIDS in 1988. And I was working for the AIDS Action Council. It was a fundraiser, and they had just colorized the movie A Star is Born. So Time Warner gave us the movie to show, and we could raise money using that. So we had 600 people in the room, and those 600 people were sitting there at about 8 o'clock in the evening, just as the movie was starting to play. There was beeps all around the room. Beeps coming out of people's pockets, and everybody was thinking, what the heck is going on here? And my mom was with me, and my pocket was beeping also, and she said, what's going on? And I said, those are the pill boxes for people taking AZT. And the AZT you had to take every 4 hours, so you had to have a pill box in your pocket, and it would have an alarm on it so that you'd remember. You took it at 8 o'clock, you took it at midnight, you took it at 4 in the morning, you took it at 8 in the morning. It was a pain in the backside to take. But it really was something. It was the only drug we had at the time. So it was very important for us to do it. Let's fast forward a little bit. Now, I'm HIV positive and have been since 1986. And I take one pill, this pill right here, every day before I go to bed. And it keeps me healthy. It keeps me undetectable. It keeps the chances of my transmitting the disease to any sex partner very, very, very low. And it is a very important prospect for everyone, as Dr. Scott and others have talked about, how important we need to move to get to this 90-90-90. The one thing that hasn't changed, unfortunately, is the stigma and the ignorance that's still out there around HIV. We saw it with the Charlie Sheen announcement and his status. The good news about Charlie's announcement was that people are actually talking about HIV again, and people were having family conversations around the kitchen table, and they were actually understanding it. The last time this really happened was when Magic Johnson did it, and that was in 1991 when he made his announcement. The bad news of Charlie's was that it really did highlight the misunderstanding and the stigma that still exists in our society. It's still a monumental obstacle that and until we tackle the pervasive problem of HIV stigma, a problem that prevents many people from getting tested for the virus, and for many living with HIV from getting into the care that they need. So close, but yet so far. A global decline in new infections over the last several years should not distract us from the fact that the rate of new infections in many cities in America is equal to those of third world countries. Increasing among African Americans, as well as gay, bisexual, and other men who have sex with men, is a major issue for us. In AIDS Project Rhode Island, several people who work with us in AIDS Project Rhode Island are here today, and I will tell you that every week at our staff meeting we hear a story about one more person who is HIV positive, who's a client of ours, who has never told their parents, never told their spouses, never told their families that they're HIV positive, because they are afraid of the stigma, and they are concerned about their lives and moving forward. Stigma, fear, and shame impede adequate HIV testing, treatment, and care compliance. Working to erase stigma is a critical step, and it should underscore that in every strategy we undertake. I'm pleased to announce today that APRI is redoubling our efforts to educate and fight stigma in our community. Our goal is to remove any barriers and fears people have about getting tested and about getting the treatment they need. We're partnering with AIDS Care Ocean State and Walgreens, which I think is very exciting, and we're going to have testing at 4 urban core Walgreens within the next couple of months. Our goal there is to basically, it's really a great idea, it's really the whole goal of that is to make the test more routine and to make it more accessible. We've also begun to work with Reverend Don Anderson, who's here in the crowd. Reverend Anderson, we are very pleased. He is going to be working with us to allow us to get into some of the churches, in the African American churches and the Hispanic churches, where the disease is being spread, to do testing, to do messaging, and to actually engage the pastors and the people that are in those churches. And we're very excited about that. We're also going to use and deploy the full resources of AIDS Project, of Family Service of Rhode Island. We're going to connect with our collaborators, our partners, and our 9,000 clients so that we have every community in Rhode Island hearing the message about HIV, the lack of need for stigma and lack of need for fear. We're very excited about the future of this endeavor, and I hope that next year when I'm standing in this room doing another observation of World AIDS Day, that I can tell you really positive stories about how much progress we've made. Thanks very much.